A great pleasure to welcome Romulen Pillay, the Managing Director of Phillips Southern Africa, to What's Next. Romulen leads up the Southern African management team for Phillips, a leading health technology company that's focused on improving people's health and well-being through meaningful innovation, and they do a fantastic job doing that. Phillips's patient and people-centric innovation leverages advanced technology and deep clinical and consumer insights to deliver personal health solutions for consumers and professional health solutions for healthcare providers and their patients in the hospital as well as at home. And it's a great pleasure to welcome you, Romulen. How are you doing?
Really great, and thank you for having me on here.
It's a pleasure. I was just thinking back, 20 years ago, it would be unimaginable that, your patient could be at home and your doctor could be monitoring certain of your vital statistics from home. And it just changes the whole care and recovery of whatever you're going through in terms of a medical crisis. But to be able to be doing this from home while your doctor's monitoring you is quite astonishing. For our viewers who may not be aware, what does the Phillips Future Health Index report investigate?
Well, the index is the largest of its kind, and it's done over 14 countries. This is the 8th year that it's in. Now, what it does is it investigates the views of healthcare leaders and, in this year, young healthcare professionals in how they view the future health outcomes, and also things like virtual care, telemedicine, etc. How is technology being adopted, specifically digital technology, to improve health outcomes, and then just collects these insights.
That's so interesting. So you say this is the 8th one of its kind. This is the eighth index that's come through. It must be so interesting when you compare the first one to this one, and the insights are absolutely so fascinating. So why is it so important for Phillips to contribute these valuable annual industry insights?
I think these insights are needed for the bigger body of knowledge, right? And if you look at the need to deliver more efficient, more effective health outcomes, this feeds that, right? So you're learning from your healthcare professionals, your healthcare leaders, and your young healthcare professionals about the trends, about the benchmarkings, right? And these need to be tracked. So this is where the research becomes extremely important.
And Romulen, this research that was conducted, you mentioned it was across various countries. Was it across all sorts of developing countries, developed countries? Because they've all got different healthcare systems. So did you transgress right across different kinds of healthcare systems?
Yeah, that's correct. In fact, it looked at 14 countries, and this was a mix of developed and developing countries as well. However, in South Africa, you have quite a large pool of key opinion leaders, and the level of sophistication of technology adoption is quite high. So it
Yes.
also makes sense to use South Africa within this body of knowledge as well.
Okay, very interesting. So now one of the index's findings, which I found fascinating, was that healthcare leaders are looking to streamline processes to help improve efficiencies. Because, today we're all talking about efficiencies. These processes need to be smooth. And this is particularly important given the sector's acute workforce shortages, and it's a big problem globally. What technologies are they embracing to achieve these particular streamlining goals that have been highlighted?
I think you mentioned the key point there, right? How do we do more with less? So an example would be in an ICU environment, right? So we, as Philips, already have some cases where it's deployed the technology. So yeah, the clinicians and the doctors need to be able to see more patients, right? So you use virtual care, right, through the digital technology to be able to see more patients. But then you also have these command centers, right, that where you have a shortage of nurses, etc., and you also have a shortage of ICU beds, to then be able to use command centers where you can view the vital signs of patients, you can react quite sooner and make the best use of the stuff available to you. But then you also have examples where the patient wants to get home a lot sooner, right? So you also want to free up the ICU beds to treat more patients where you have a resource constraint. So then the patient can then be monitored in the home setup through the virtual care and things like telemedicine, etc., where the doctor can then monitor and also with wearable devices as well.
How fascinating. And I guess that we've also learned so much over the last 3 years through COVID, right? Where we saw this crisis globally, where there was a shortage of beds, and healthcare professionals needed to streamline the process and say, like, if you're well enough to recover at home, stay at home and recover. And I guess we need to be prepared for a crisis like that again in the future, because it certainly is not if it will happen, or if we will get another strain like COVID, but there's a likelihood in the next few decades that we will have something similar again. Now, another interesting insight from this particular index I was reading was how different the local stance on virtual care is to the global view. Why is virtual care such a priority in South Africa, and how is this being facilitated on a technology level?
If I go back to the previous example I used, particularly in a ICU environment, right? So we have many ICU departments in many hospitals, both in private and public sector, and the number of patients being treated is very high, right? We have the issue of quality access to care, which is also an imbalance. And in that type of scenario, the doctors have to do more with less, right? And you have a limited amount of specialists. So the virtual care then allows, for example, a clinician or a doctor to then view more patients, right? And not necessarily be physically present at the bedside. Similarly for nurses, but then also in a South African context, you also have a big rural community that goes to primary healthcare and the clinic setup. An example would be for the World Health Standards say to us that each pregnant mom or expectant mom needs to have a scan within the first 1,000 days, and the stats in Africa are not that great. So what happens is you use something like a portable ultrasound device, which we call the Lumify, which then is able to be carried into the rural setup to do a scan on an expected mom, so that you can get early risk stratification. And then those images can be fed back through the phone or through the tablet back to a doctor sitting at a tertiary hospital or an academic hospital or the secondary hospital, to then review that and be able to help, right? The idea being that if there are any early risk factors, then to be alerted earlier and treat the mother. So I think the reason why the virtual care adoption is so much higher in our area is because you have, I think, the will and purpose to want to treat more patients in the rural setup. But then also in the hospital environment, it's becoming increasingly expensive, right, to maintain ICU beds as well. And then you add to that the shortage that we have of specialists, right? It makes sense.
Wow, I mean, when you talk about that scanner, for example, that excites me, because I mean, even if you look at the price of that device versus the one that's the big thing that they've got in hospitals, it's like a fraction of the cost, and yet you're able to have that flexibility to move around and see more people, and ultimately get those results to the people that need to look at it and decide on a prognosis, or decide on where that pregnancy is. Now they do remain barriers. Let's be honest. There are many barriers to deliver the best possible medical services in South Africa. We are making good ground, but there are those barriers that still exist. What are the most prominent of these particular obstacles, and how are health care decision makers working to solve them? What are they doing around this and to get through those obstacles that I believe, and I'm sure you believe too, these are solvable problems that we can overcome?
Absolutely. And look, I think the starting point is a good point, because I think we're blessed in this country with a very high IP in both public and private segment, and you have a high level of key opinion leaders, whether it's cardiovascular or oncology. Now, if you take that resource pool, right, and you take the challenge that we have, and we're able to better collaborate and partner, then definitely we can help address some of these areas. But when you look at the challenges, just as the survey pointed out, that most young healthcare professionals and healthcare leaders see technology as the bridge to that gap to quality access healthcare, and underpinned by digital technology. At the same time, they indicate that the level of investment, is so disparate, right? It's not at the rate where it needs to be. So if you look at the type of technology that's needed to address this staff shortages in, for example, public sector, hasn't kept up with momentum, right? So that's one of the gaps you have. Then you also have the training need, right, where you have to upskill a lot of healthcare workers and clinicians and professionals with the new technology. So, an example is where you have different OEMs like myself, where you have maybe a CT scan, an ultrasound, you have a MRI, you have an X-ray. The technology that's embedded in there needs to be interoperable, right? So vendor agnostic. So if it doesn't, then you present a gap for the clinicians and doctors working. How do they assimilate all of that data together? Uh, Another area that, maybe to digress a little bit, I mean, I was on the panel at Gibbs recently, and there was an actuary who presented data, and he said that, with the best and smartest of technology, we will treat more patients. But one of the fundamentals to fix is employment creation, because the majority of the population, cannot survive on nutrition to the value of 25 Rand a day, right? And this is quite serious. I mean, if we can address that, I think then we able to enable people through job creation to be able to then have better nutrition, right? So that they don't end up in hospitals. The other area I think is a gap is in the way technology is adopted. Right? I think we need the OEMs and the different technology companies, together with the research councils and government and private sector, to come together so that we're building the right platforms. I think there's too many good initiatives that lose momentum because there's not this level of collaboration. I mean, you said it yourself that imagine if we could come together, we'll be able to solve all of these challenges that we have in the country.
No, those are such fascinating insights. And I think the nutrition part is such an important one. I mean, it's like glaring at us straight in the face. And, if we can sort that out, and I love how actuaries think, actually, because, you sort that out and you solve a lot of other problems, and you take a lot of strain off the healthcare system automatically. When you look at Phillips, I mean, you guys have been pioneers in this industry for a long, long time. You've been developing incredible solutions, and certainly Phillips, for me, stands out in the healthcare industry as one of those, icons, those beacons of light. How is Phillips working to improve people's lives in the healthcare sector? And I imagine that there must be tremendous amount of research and development that takes place in the background without, the day-to-day user like myself seeing this.
No, we have some very real examples in South Africa. In fact, many. Whenever I have visitors from outside of South Africa come in, I take them through to California, and at the same time to a hospital like Centocare. In Centocare, for example, the cath lab, it's very much designed around the way clinicians and the cardiovascular technicians come together in the workflow, right? So we're doing a lot of R&D in the workflow, so that the doctor or the clinician can spend more time on the patient, right? And then the data, I mentioned this concept earlier about interoperability. So in a hospital environment where you have different equipment, where the diagnosis and imaging is being done, our technology then is allowing the data to come together so that a better care pathway can be built by the clinician. He has more time. So some of the concepts like AI is going into the radiology environment to help get a diagnosis a lot sooner. Then if you consider areas like the Eastern Cape, right, where we have the mother and child death rate is very high, and resultantly the medical legal claims are quite high. So there we've partnered with the Ministry of Health to deploy a solution that will digitize the risk stratification for the mothers and babies very early on from the rural setup through the secondary and tertiary hospitals, so that we can reduce the death rates, right? And at the same time have a digitized record, so that when that patient goes from a clinic to a hospital, the risk profiling and the stratification can be done better. But at the same time, you have quite an advanced pool of key opinion leaders in the country, very advanced specialists. I always like to use this example at Red Cross Children's Hospital, where our hemodynamic system initially didn't cater for the level of pediatric cardiovascular procedures they were doing. And over a period of a couple of months, we were able to innovate and build that back into the system, so that that body of knowledge not only benefit South Africa, but also the rest of the world, right? And because of the level of specialization being done by the clinicians in the country. So these are some of the areas. Other areas include, if you consider uh, environmentally sustainable processes, and the use of equipment is quite important at the moment, right? Helium free at a right clinical standard for MRI scanning. We're the first to pioneer this, right? In fact, the only company at the moment that can supply this. The challenge we have is keeping up with the demand. But as I sit here, there are at least several installation sites taking place in South Africa and Southern Africa, where helium free is being pulled by the private sector and government sector, which is quite encouraging to see for the long-term total cost of ownership, also to meet the right ESG guidelines and goals. But also it's quite expensive to have an MRI that runs on helium. So these are many areas in the country where these solutions have already been deployed. I can speak a lot longer about many other areas in the digitized space, but for now, I think that's sufficient.
Thank you so much for those fascinating insights, Romulen, and sharing that the interesting research that's come out of the index. Romulen Pillay, who's the managing director of Phillips Southern Africa, thank you for joining us on What's Next.
Lovely to be here. Thank you.